All right, welcome to the Public Administration panel on careers in law enforcement and emergency management. We're going to be discussing how obviously public administration can inform careers in the law enforcement emergency management sector and kind of the career path to going into law enforcement, emergency management, skills that you should think about developing if you're going to go down that career path. So I'll let my guests start out by introducing herself if you'd like to.
Sure. Rebecca Connors. I am an operations manager at Charlottesville-UVA, University of Virginia, Albemarle 911 Center in Charlottesville, Virginia. I was hired into my role in March of 2023, and I moved here across the country, didn't know anybody, that sort of thing. But I was hired based on my educational background and what I was beginning to do and also experience. In addition to that, I am the TERT, Telecommunicator Emergency Response Task Force Regional Coordinator for FEMA Regions 3 and 5, and I am the International Committee Chair for the National Emergency Number Association, commonly known as NENA, Joint TERT Working Group.
All right, thank you. And I think you kind of segued into the first question, which was about kind of your starting off looking at kind of the educational side. What was your educational background that led you to your current position?
This is a good story, and I don't know if we have ever talked about it, but I graduated high school in 2008. I grew up in Gary, Indiana, and I went to Calumet New Tech High School is what it's known by now. And I wanted to teach music. And so I began my journey at Indiana State back in 2008, and I had pursued a degree in music education. That is typically a 5-year program. And at the end of year 4, I just didn't have the finances to continue with the program. And so there was a lot of other factors, but I left the university at that time and I took some different jobs. I was a director of youth ministry at a church for a while, but I always loved teaching music. So I taught a lot of private lessons and that sort of thing. There was a college that was more local to where I was at in Gary at the time, and it was St. Joseph's College in Rensselaer. It is now closed, but I tried to transfer my credits from Indiana State there. And if you ever try to transfer from public to private school, definitely send me an email. I'll give you some tips and tricks. But basically I had to restart my degree for several reasons. And by the time I was about to finish, the college closed. And so I continued doing what I was doing, and I was teaching some K-12 music at a school in Gary. And then I was teaching music and music theater at a performance studio in Chesterton. And so I had been doing that for a few years, and I managed the studio at some point. And I was like, you know what, this pays okay, but I don't have insurance. And I was about to be 26. And so with all the laws changing that I didn't really understand and that sort of thing, I'm like, hey, I really need insurance and I need like a big girl job. That's what I called it. And so I had asked around different folks, hey, does anybody know who's hiring? And my aunt was a lifetime dispatcher. She had almost 30 years at that point. And she said, hey, the 911 center is hiring. It's a lot of work, a lot of overtime, but it's a good job. And I said, say no more. And I applied, and that's how I got started in this career. And at the time when I got started, I thought it would just be a stepping stone to something else or a holding place type job. I was still pretty set on teaching music, and I was going to figure out a way to finish that. But I found out that I really loved the job. And I really love helping people and giving back to the community in that way. And so I started my career as a 911 professional. I started in early 2016, and I was making $12 an hour not quite 12, it was 11 and some change. But I had insurance, and so I saved up. And it took me a long time to save up, and I was finally able to come back to Indiana State. And this time I did not finish a degree in music education, but I did something that worked for me with my career, and that was the adult career education program. And that focused on some HR related things, some organizational leadership type things. And I got my bachelor's of science in December of 2022. And so right before I moved to Charlottesville, I got my bachelor's, and then I was able to jump into the MPA program. So kind of a whirlwind, but one thing for me personally is that education is very important. And so you don't know what you don't know. And I think that there's a need to learn the answer or find out what the answer is. And so for me, that was my journey into education, or through education. As far as work, I worked for 5 years at Lake County 911 in Northwest Indiana. And then I moved and I did a stint in Pennsylvania, and then I came to Charlottesville. Every time I moved up in my career. So I started out as a basic call taker, and then I learned how to dispatch, sending police and fire and EMS. And then I was a training supervisor manager, and now I manage operations. So very different, but very progressive.
All right, thank you very much. I appreciate that. And your story kind of reinforces a previous discussion that we had the other day with another group of MPA graduates and students about kind of the interesting path that people can take to get to their career. You know, how there can be, you know, some twists and turns, but if you just the takeaway, what they were talking about was you need to be open. You know, you need to be open to different possibilities, different opportunities, and eventually the right thing will present itself, as long as you're willing to kind of take a chance and maybe go outside your comfort zone a little bit and things like that. So I appreciate that your story is kind of the same.
I know we'll get it. Oh, sorry.
No,
yeah, I know we'll get into it a little later, but for me, the MPA program being online and like mostly able to do it at my own pace is really good for me in my current role specifically, because I can kind of plan it around my schedule. And so that, like you're saying, being open to different opportunities, for a long time, I really struggled and felt like I needed to be in the classroom to learn. But over the last several years, I've learned that me personally, I do better with online, because I can rewind if I need to, or I can, if parts I know, I can speed up a little, or whatever the case might be. And so holistically, like, this is a great program. It's a great fit for me. And so I'm glad that the opportunity was there.
Thank you. So the next question is, in terms of your current position, what would you say is the most rewarding aspect of your current position?
I still think it's helping people. Public service is a tough job. It is a thankless job. It is a hard job. In 911 specifically, people are calling you on their worst day, in their worst moment. In my current role, my focus has shifted a little bit, and that is to my coworkers. And so the people that I manage, where I am, we call everybody coworker, because subordinate or manager or whatever, we all work together and we're coworkers. And so in my current role, I get to serve my coworkers. And what that does is it not only helps them, but it helps them help others. And so I think the most rewarding part about my position is not only getting to help my frontline coworkers, but I also get to connect with police officers and firefighters and paramedics. And I get to connect and work very closely with emergency managers from different cities or localities, different police chiefs and all that sort of thing. So I get to help people, and I get to help them understand what it is that we do and how we manage emergencies.
So the next question is kind of the flip side of that, and that is, what would you say is the greatest challenge, or what are the greatest challenges associated with your position?
So I laughed when I looked at these questions that you sent, because the answer to that is also helping people. And I know maybe how it sounds, but in a role like mine, or in a role in like emergency services or emergency management, people are always needing something from you, always needing help. They're always needing, advice or information, or, response or something like that. And so it does get tiring at times. And the best way to overcome that is self-care. So taking out the time that you need to make sure that you're being a whole person, both mentally, physically, spiritually, all of those things, but doing what makes you feel whole and appreciated and all of that too.
Could you talk a little bit about how concepts from public administration have helped you in your professional life since you've been involved with the MTA program and being in your current position?
I love this question, and I will say that it has helped quite a bit in many different ways. But before I get into some specific things, I want to say that it's really interesting because oftentimes what we're dealing with at the very surface level are concepts that we have discussed in the program. And so, for example, one of the things that came to mind was like organizational theory and behavior. And so in one of my classes, we had discussed different types of organizational structure, and it had come up about open and closed structure. And we had some coworkers saying, well, there used to not be any rules, and now there are, and you're holding people accountable. And that's a tough challenge for many reasons. But thinking about that like open and closed type model, I was really able to help those coworkers explain like there has to be some level of accountability, especially in our line of work. But also there has to be a healthy dose of like the people who are actually doing the job getting a say in what is happening to them. And so as adults, I think the educational piece is that we want to have a little bit of control over our lives. And often in public service, particularly emergency services, it is you do what you're told type of atmosphere. And so that often becomes a struggle. And so they had gone from one extreme to the other and had no rules, and now we're holding them accountable. And so that organizational theory and that idea of like adult behavior was really helpful to navigate some of those situations. Another thing that we have touched on multiple times throughout the program is like human resource type things, mainly like dealing with stress or like employees' wellness, but particularly program development. And so when we're talking about different programs, like they can be large scale or small scale. In a center like mine, we have started wellness programs where we're paying the coworker just to do, a stipend every quarter. They get a stipend just to do something that makes them feel well. And so starting the program, getting the backing for it, all of that sort of thing, studying the MPA program is really helpful. Stuff like that can help employee retention, and it can be vital in reducing burnout and turnover. And so we are about a year into a program like that, and we are starting to see that shift where we're starting to see people taking, like really signing up for starters that program and being able to get the money. And then we're getting to see kind of the outcome of that too. So what did you do with it? They don't have to answer, it's not required. But some people are really forthcoming, and so some people are paying for their gym membership, or they are having a spa day, or buying a fire pit for their backyard, whatever it is, helping them be and feel more well. Some other things that I thought of when I was thinking about this would be like public policy and decision making. And this really came into play very recently. Just like having knowledge about public policy can help a manager, like in my case, understand the impact of regulations or new policies that are coming out, like how to understand what those words mean. A lot of times laws or like state law or whatever might come out, they might change the law. What does that mean? How does it impact you? How does it impact your employees that you're working with or your coworkers? And then how can we, you know, follow these laws or these rules, but also be doing the best right thing for the most amount of people. So it can, knowing these types of things and being able to understand them, it can guide in decision making, particularly in situations where protocol might have to be changed or adjusted, or like I said, there's a new legal or regulatory framework. This also came up recently for me personally, during the debate. I don't know if anybody watched the debate, but they were talking about the city of Charlottesville, which is where I am, on the debate and some things that happened. And so very political things, very public things. But as a manager, not only do we have to understand the political ramifications of that, but also the personal impact that it has on our people and the people that we manage. And so after the debate came up, I had many, and I wasn't here when all of that stuff happened back in 2017 or 2019. I wasn't here in my role then. But those things are still coming up, and they're still coming up on a very public scale. And then it does still affect the coworkers that were there and working that day or those several days. And so kind of understanding how politics can really affect the people doing the job becomes really important. And that kind of ties me into the last two things that I thought of. The first one was like leadership and ethics. And so really talking about this emphasis on ethics and helping ensure that people coming out of the program are making good and effective decisions, and they are morally in the right. So not saying that everybody has to believe a certain way or think a certain way, but like, how do you get to the best right decision, again, for the most amount of people? And this comes into play a lot in my role doing emergency management and managing a 911 center, because we're always dealing with very sensitive information, dealing with life-threatening situations. It could be storms. It could be like with the university, we have, thousands upon thousands of fans coming in and out. And if there's a bad storm per se, evacuation, entrapment, collapses, that sort of thing. So really being able to take leadership and make it a split-second decision with that moral high ground, if you will. And then the last one I came up with was budgeting and finance management. We do quite a bit of math, and I wasn't really expecting that going into the program, but it has been very helpful. One of the things that I do is I manage a committee at my workplace, two of them. One is community engagement, and I'm responsible for ensuring that we can get enough items to give out to the community. And also we have to be fiscally responsible because I pay my coworkers to attend those events and to help educate the community. And then the other one is called Coworker Champions. And it kind of goes back to like human resource management a little bit. But that one is all about how we can make our workplace better. And so some of it is deciding what can we do now and what can we do, but maybe a little later. And then, monitoring the fiscal responsibility of that.
All right. Thank you very much. I appreciate that. That was a I've asked that question a few times in a few different conversations, and that was by far the most thorough answer that I've gotten so far. So I appreciate that. Kind of along the same lines, is there one, sort of particular, memorable or valuable piece of information that you've taken away from the program that has really stuck with you, or that you think will be particularly valuable as you kind of move through the rest of your career?
Yes, and it is both probably the most valuable piece, but also the one that I struggle with. Not struggle because I can't do it, but because I don't like to sit down and do it. And that is learning how to properly do research. And so that has been a struggle for me because I like data. I like data. I do not like to go find the data. I don't like to do that piece of it. I am really lucky where I am because I have coworkers that love doing that. And that makes us a good team. But because they go and they find the data, and then they put it together, I'm able to quickly look at it and make decisions based on the data. And so I think research holistically is one of the best things, probably one of the most valuable things that I've gone through or learned through this process. It has helped me, I think, be a better manager, but also when there are decisions to be made, sometimes I'm like, wait, let's go see what the data says. Because we might think or feel that one answer is the answer, but when you look at the statistics or you look at the data or the research piece of it, you find that the actual answer may be very different than the perceived one. And so that's been really helpful in my current role, and I imagine that'll be very helpful in the future.
Very much for that. Making it. So what is, so kind of continue, you were just talking about research. So the next question is about public administration research. So, for academics in the public administration field or students who might be doing public administration research, what would be a particular question or a particular issue that you would really like public administration researchers to focus on and try to get a better understanding of?
I love this question, and this is something I think you and I have discussed a lot at length, or quite a bit at length over the last couple of years. But if there's anything that I would like to see public administration research pay more attention to, it would be the ramifications of mental health and what people, not only for police and firefighters and paramedics, but also 911 dispatchers. Very often when we are looking at the mental health outcomes for first responders, dispatchers are left off. Partially because dispatchers are still classified as clerical by the federal government, and so they don't necessarily fit into that protective service category. But without them, like the other side of that is without them, when you call 911, if they weren't there, who would answer your call? And so I think that a few things I would like the research to be more frequent, but also paying attention to the outcomes. There's very, very few studies out about how these traumatic events that dispatchers might hear play into the mental health of those people. And so I would like to see that researched. And there's different avenues that one could take to research it. But I hope eventually that it becomes more talked about, more discussed, and not just by the dispatchers. And the reason I point that out is because if you look at the population of the United States, it's pretty high. I don't know the exact number offhand. There's like over 1 million EMS workers. There's like close to 1 million police officers. There's over 1 million, if I'm not mistaken, firefighters, but there's only about 150,000 dispatchers. And so the statistic is pretty alarming when I'm going to look it up. I have it on a post-it note at work, and I wish I would have brought it with me for this conversation. I didn't think of it. Yeah, so in 2023, there were approximately 102,700 public safety telecommunicators in the country. And so when you compare that number to the other responders doing the more like dispatchers, they're the first responders. And so when you look at the other first responders, maybe those who are going to scene, there's a significantly more amount of those people doing that job. So we often get kind of left off, but also without 911, there would be no response. There wouldn't be a response during hurricanes. There wouldn't be a response, you know, for people who are trapped or get injured or all of the things. And so the other thing along that I would like to see more research on would be the retention. Why is there such high turnover? Not only for our 911 dispatchers, but also just public safety in general. What is making these folks leave the field rather than join it? I don't really have an answer to that question, but I would like to see one, or would like to find one someday.
Thanks for that. That statistic is surprising about the number of dispatchers. I think I'll probably, if we have time later, I'll come back to that because I want to explore that statistic a little bit more. Because I think it's really interesting. But well, actually, you know, before we get into, you know, kind of the latter questions, there were some points that I kind of wanted to go back to and delve a little bit more deeply into. So you had mentioned being a part of the CHIRC organization or the CHIRC committee, and you mentioned being a member of an international organization. So could you talk a little bit more about what those organizations do and kind of how you're involved with those?
Sure. So in public service, police officer, firefighter, paramedic, 911, most of the jobs you do not have to have formal education to get the job. You can be hired into the role. Most of it is on the job training. Now there are certification classes for each. A lot of them, like for police, you'll hear them talk about Law Enforcement Academy. It's a physical where they teach physical fitness and different types of things, tactics, but they also teach them the law that they need to know in order to be successful in their role. For EMTs and paramedics, they go through certification courses where they learn how to provide paramedicine. Firefighters, they also take certification courses, firefighter 1 and 2. There's different certifications if they decide to go to the rank of captain or learn how to investigate fires, that sort of thing. For 911, the certifications are very different because globally, because of the classification at the federal level, there's not really any certifications that are required to do the job, other than there's a federal mandate that centers are supposed to have EMD, and that is emergency medical dispatch. Those programs, they're not federally mandated. It can be any program. You can write it yourself, as long as you have a medical provider in your area sign off on it. And so where I'm headed with all of that is there are some heavy hitting agencies that are standard setting for 911 specific, like 911 emergency dispatchers. The one that I chair for this committee, the TERT, Telecommunicator Emergency Response Task Force Committee, is NENA, National Emergency Number Association. And they have various certifications. They have like a CTO, Certified Training Officer certification. They have a CMCP, Center Manager Program certification. They have various certifications. The one that I'm testing for come in October is the ENP, Emergency Number Professional. It is a pretty heavy examination. It's 150 questions and you have to pass with like 70%, I think. But there's no class for it. It is, here's all the information you have to know, learn it, take the test, whatever. APCO is like another heavy hitter industry organization for 911 specific. And that is another organization for 911 public safety officials. They do conferences. I just spoke at an international APCO conference in Florida recently. But both of them, they have their different certifications. APCO's, I think, is RPL and CPE. They're about the equivalent of NINA's. But these are like your standard setting organizations. So they use the ANSI standard process. And what they have done is develop over years, many years, standards for 911 professionals. What does it look like in the 911 center? What does it look like when you are providing service to someone who is deaf or hard of hearing? And so the specific one that I'm chairing is the International Committee for TERT. And that is, TERT is basically like a FEMA deployment, but it is for 911 professionals. So when a 911 center is taken out in one of these disasters and you need a team of dispatchers to go in and do the job, who can we call? Who's ready? Who can we send? And so on that committee, what we are doing is we're rewriting the standard, developing it further. They change, I think, according to ANSI, like every 5 years. So we're looking at how things have progressed over the last 5 years, kind of future forward thinking of where things are going, what the need might be, and trying our best to kind of accommodate that too. The other part of that is NJTI, National Joint TERT Initiative. And that both of these are NINA and APCO committees. And so for the NJTI, I'm the TERT regional coordinator for FEMA regions 3 and 5. And so that includes Indiana, and that also includes Virginia, just to kind of give you a piece of the span that I cover. One other heavy hitting industry certification company is the International Academy of Emergency Dispatch. And so through them, I am a certified instructor and I'm able to teach some certification classes for them too. Does that answer the question?
Yeah, no, that definitely does. Just as a follow-up, so I mean, you said there's a number of sort of organizations that provide credentialing and certifications. So how did these organizations develop? Was it kind of a grassroots bottom up where people in the field felt like there needed to be these standards, or were these standards kind of originating with the government saying that we need more standardization?
Yes, all of it. But they are considered private entities that do public work. And so NINA, for example, they don't actually have very many staff. And I do believe, don't quote me on this, but I do believe both of them are not-for-profit. So they are doing these standard setting work. So for example, I chair this committee and I work with people from all around the country and international. We join a call once a week. I manage that call. And I also maintain the document that we're working on. But all of us volunteer. I don't get paid for that particular thing. It's a volunteer role.
So kind of continuing in a similar vein, so you had mentioned you know, when we were talking about different concepts from PA and how they applied, you were talking about the open close structure and kind of people chafing at accountability. So in terms of sort of evaluating the performance of 911 dispatchers, like what does that performance evaluation look like? How do you determine whether or not a 911 dispatcher is doing a proficient job or not?
I love that question. And here's why. We just recently changed the process for internal. And so what we do is we relate their job back to our core values. Our core values are golden. So being generous, open, leaders at all levels, dedicated to service, efficient and empathetic, and notable. How does their role or what they're doing in their particular role, how can that relate back to the value? And so it is finding things like, are you showing up to work on time? And where does that come back to, right? Efficiency. Are you showing up to work on time? Notable. Are you doing, we use quality assurance as part of this too, but are you doing the right thing? Are you following the protocol? Are you sending the right help? That sort of thing. Are you going out and speaking at conferences? Are you joining committees? Are you doing work that maybe we don't talk about? So we have a coworker support area or a coworker like snack area. And we have a particular coworker that goes out, she goes above and beyond on her own time, and she gets all of the supplies for that. And then she comes and she stocks it. So we're looking for like those notable things where maybe folks are going above and beyond. You know, if they're being generous, there is a lot of overtime in this field. Maybe they're working more than their fair share. Are they open to learning? Open to trying new things? Are they dedicated to service? Are they showing up? Are they doing the right thing? Are they getting people the right help? So all of these different kind of aspects of their job, we relate them back to our core values, and then they're evaluated quarterly based on that. And so when we're talking about their quarterly evaluations, some really cool things happen. We set goals for each coworker. So there are some standards out where most of your calls have to be answered in under 15 seconds. And so we can pull the data and do the research. You know, are they answering their phone calls in under 15 seconds? And so maybe a goal might be to answer, you know, 90% of your calls in under 15 seconds or 95%, whatever the case might be. And then we set goals for them, and then we follow that until their next quarter. Did they meet it? Did they not meet it? How can we do better? How can we support you in that? Those quarterly goals then lead into their annual evaluation. And so we kind of look back and we say, okay, these were the goals. Did you meet them? Did you not? And then they're given their annual review. And so we consider all of the different things throughout the year, notable things that they've done, maybe things they didn't do so well. And then they're scored based off of those values. And then they are paid for their performance. And so they get a additional stipend, like an annual allotment based on their review. So that's how we do it.
Yeah, the idea of pay for performance again was something that came up previously in another conversation, because somebody in reference to kind of higher education and kind of the way that, you know, raises work at universities and places like that. You know, typically there's kind of an across the board sort of raise that happens. There is occasionally some pay for performance kinds of things that happen periodically, but it's fairly rare that happens. And one of the criticisms of pay for performance is that causes some friction, I guess, within organizations. People are sort of jockeying for the raises and competing with each other. Have you found any of that to be true from your perspective?
So I think it would have been, except for our HR manager is a rock star, and she developed a framework that basically it'll change every year based on the finances or what the board approves, because we operate under an executive board. And we have a really great board. I just want to pause for a second. And I'm gonna backpedal, and then I'll get to how pay for performance works. But our coworkers, they do get cost of living raises as the board approves. But beyond that, they get a 2% raise every year. And so all of that we're very transparent about it. You can find it on our website. What starting pay might look like, what it might look like at 10 years, you will know. And as our board approves, a cost of living, we put that out again. And so our information is very up to date. But our coworkers get a 2% step increase for every year of service. If they promote to another role, they get an increase for that as well. And that's our frontline coworkers. It is a little bit different for salaried folks. But with that, with pay for performance, we all receive an evaluation, and our pay for performance is slightly different. In my role, I'm salaried. So mine is a percentage of my current rate of pay or my current salary. But for our frontline coworkers, which is the large majority of our organization, pay for performance is a one-time paid out annually bonus that they get. And so in order to keep it fair, basically each category is kind of broken down into a number. So they get paid for their, like if there's like 5 categories, and they would get like $250 for this one and $250 for this one or something like that. If they have gone above and beyond and they were, very notable, we do have the capability to award them more based on certain parameters that were set out. But it is in certain increments. So it's not like you could say, oh, well, this person did this. They're getting, $10,000 or something like that. It's not like that at all. In the parameters across the board, they have to equal out a certain number. And then increases are very off of that main number. You have to have a lot of data to prove it. Does that kind of make sense?
Yeah, no, that totally makes sense. So it does sound like there's a fair amount of, because all of you talked about sort of, doing service as part of the evaluation, but that's essentially doing work that's outside of the requirements of your actual job, I'm assuming, right? So it sounds like there's a fair amount of sort of unpaid labor that goes into it that you're still evaluated for, but it's not officially the job, but it's sort of socially expected. Is that
I would
fair?
say no. So in a lot of places, yes. In our place, no. If they are doing committee work, they're getting paid their hourly rate. If it's overtime for them, they're getting paid their hourly rate at time and a half. So they are being paid for the time that they spend working. So, we have folks that teach in Virginia. There's a state academy. And so they are certified instructors for the state of Virginia. We pay them to go to the academy and teach whatever their rate might be. If they teach in our in-house academy, we pay them for their preparation time. So we pay them to prep their material, and then we pay them to teach their material. You will not find that everywhere. I can tell you that more often than not in the industry, there are people volunteering their time to be notable or whatever. For us, people are paid for their time.
Okay,
so
that's a good point of clarification, because there is, in a university setting, technically, when I signed my contract to work at Indiana State, I signed a contract to teach X number of classes per semester. So, I mean, if you look at the contract, my work responsibilities are fairly limited, but at the same time, there's tenure expectations that require research and service. So you have to publish a certain amount of articles and serve on a certain number of committees. So like if you look at, the contract that I signed and how much that I'm paid, technically, if you look at the letter of the contract, I'm paid to do a specific set of things, but then there's all these additional expectations. So I just kind of wanted to get a sense of the degree to which that was also true in that area as well.
So I would say for me, like my contracted hours are 40. But I most of the time work anywhere from 50 to 70, sometimes 80 hours a week. And that is based on the needs of the coworkers that I manage a lot, or other things that might come up. When I was talking about like the moral high ground or doing the best right thing for the most amount of people, that really comes into play when you are in public service, often in a manager role in emergency services, whether it's police, fire, EMS, or the 911 center. I have found holistically, and if somebody correct me if I'm wrong, but more often than not, we're volunteering our time on a lot of it. Because we're trying to do the best right thing for the people who are actually out in the front line. So for me, for example, like I very rarely take phone calls or dispatch anymore. A lot of what I do is like policy work or managing different aspects of coworkers or communicating or going to meetings, that sort of thing. But like this last Saturday, for example, I had some coworkers who were sick. And so they were going to be under minimum staffing. So even though Saturday, that was my day off, I went in, I was not paid for the whole 12-hour duration because I was over my 40 hours. But I went in so that the community and my coworkers wouldn't have to suffer. Small example, but stuff like that happens.
Thank you for clarifying that. Something you said that I kind of took note of was you mentioned the references to Charlottesville, which came up during the recent presidential debate, but I think comes up fairly often during the campaign in different contexts, which is it's kind of interesting because what it sort of said to me was that there's still a certain amount of trauma that people are trying to work through from those events, and maybe people outside of the community or who weren't directly affected by those events maybe aren't maybe being as sensitive as they could be about the trauma involved there. Do you find that to be kind of maybe an unaddressed problem in the emergency management field where we talk about 9/11 and we talk about these different events, and those events meant different things to the people who were directly affected compared to kind of the people who only saw it on TV and things like that. So is that something that we as a public should be more sensitive about, is appreciating the fact that when we talk about these things, maybe we need to be a little more sensitive in some ways, or a little more tempered in our comments?
I would say yes, and absolutely. I think 9/11 is a pretty good example, and it's a very hard example. But I remember exactly where I was when that occurred. I was in school, I was in 6th grade, and basically the world stopped turning for school. Most of us didn't really know what was happening at the time, but they hushed us, they turned the lights off, and they said, watch TV, this is history. Like, this is bad, but this is history. And so, for me as a kid, my experience was very different, than maybe, yours or someone else's. You know, my mom worked for county government, and so they were closing their buildings. And you know, she was sent home from work. So like her experience was very different even from mine, even though we were family. Um, but I grew up kind of in a public safety family. And so there were, you know, people even from our local Indiana, Hoosiers that were planning to be deployed or thought they were maybe going to need to be deployed. And so there's a lot of things that come associated with that, because when you volunteer to go to a deployment, there is always a chance that you might not come home. And so not only is that preparing yourself mentally for that, but it's also preparing your family for that too. And then to maybe the ones that were there that day, when, you know, when the towers came down, for people that lived it, there's two sides of it, in my opinion, and I'm always open to learning. And I'm not saying my opinion is the right opinion. But I think there's different experiences even for those that were there. And so folks have their lived experience and how they lived it. And then you have the lived experience of the responders, and how the responders experience it is very different than somebody who experienced it for themselves. What I mean by that is that responder might have helped get away from the scene, you know, 50, 100, 1,000 people in 3 or 4 days. And one person lived that experience in themselves. Very traumatic. But those responders that we often forget about have not only helped that individual, but many others in their time of crisis through those moments too. And so going back to the idea of what happened in Charlottesville, we have a lot of community members who lived that experience for them, and it was very traumatic for them. We also have a lot of coworkers who worked through that experience, both in the 911 center, but also out in the public, and their lived experience changed from moment to moment. You know, as crowds come and go, they're seeing different people in different states. And so their lived experiences are vastly different than maybe someone else. And so I think as public administrators, we should be more cognizant of the damage we're doing when we just haphazardly throw these things out.
Okay.
Does that make sense?
Yeah, I think it makes sense. I just thought it was an interesting perspective, because I do think that the kind of the name, the word Charlottesville has kind of become political shorthand for that particular event that, you know, that happened in Charlottesville with the you know, racist rally that occurred, and then the counter protests and the violence that sort of ensued. So the fact that not only is that sort of a negative thing for the community, but it also, for the people who had to respond to the violence and the effects of that violence, I think, you know, being sort of cognizant that people are still kind of working through that trauma, and you know, just being sensitive to that, I think is a good point.
And again, you know, I don't, I'm not saying, you know, one way or the other. I do have my personal beliefs. I don't try to force that on anyone, and I'm not going to say one way or the other. But I think that in situations like 9/11 or these hurricanes, or, you know, even like tornadoes or floodings or fires or whatever it might be, when people are responding, their lived experience in those moments is very different than, you know, the patient. And that could be, and it's to no fault of the patient, you know, but they're dealing with a bunch of patients. It's to no fault maybe of, you know, the political folks or TV crews. But they don't understand, in my opinion, a lot of times they don't understand the stress that those people are under. Because again, it's not only how do I help you, it's also the internal conflict of helping you means I might not come home. And so then their personal struggle with that too.
So the last thing that you had mentioned earlier that I wanted to come back to was that statistic about, I think you said 102,000 911 dispatchers compared to, you know, 1 million police, 1 million, you know, EMTs, things like that. So what would you say is the rationale behind kind of that disparity? Why is there such an extreme gap between, you know, those different segments of emergency personnel?
So I'm just like looking this up so that so there are in 2022 there was 849,915 police officers. In the US, there's not a year on this one. In 2020, there was 1,041,200 firefighters. And then there were several thousand, almost like 500,000 EMS workers. And then when you look at the statistic of dispatchers, you're at like 100,000 or 102,000. Lots of reasons for that, in my opinion. People don't understand the job we do. Many places across the country, it is listed as a clerical job. And so when 911 is not, in my opinion, I strongly believe this is not clerical. Are there clerical tasks? Sure. But largely we are getting firsthand exposure to the trauma. There's a coined term, the first responder. And sometimes, in some cases, even FEMA recognizes the dispatcher as the first incident commander. That is not taken seriously enough, more holistically, in my opinion. So when somebody's calling in and their house is on fire, maybe it's an adult and they have kids in the house is on fire. How we as dispatchers manage that adult can change the outcome of that call. How we command the scene that we're not at, how we coach them through, that can change the outcome. Cardiac arrest, primary example. The ability of a dispatcher to give CPR instructions, or even in some cases, if there's an AED available, telling them how to place the pads in order to deliver shock. Those things, they're not clerical tasks. They are life-saving instructions. And there are a ton more. There is some statistics out about drownings, where cars go off into a bridge, and if you don't get out in a certain amount of seconds, you'll drown in the car. There are cases, to that note, where the dispatcher never told the caller, for example, to get out of the car. And it's, would say things like, hey, we're on our way, or like, I have help coming to you. And there have been folks found where they went off a bridge into the water, and they might have rolled down their windows, but nobody ever told them to get out. And so they were found in their car, windows down, still in there. And so it's life-saving instructions like windows down, get out now, that make the difference, because folks need to be told, especially if they don't swim, get out of the car, hold on to the roof until it starts to go under, paddle your way, just try to keep your head above water. And they need those reassurances. And that is 911. That is what we're doing. So when you're looking at the statistics of there only being 100,000 or 102,000 dispatchers, what folks are not prepared for is the amount of stress that comes with it. And so the amount of training that it takes to do the job, the amount of mental stress and the mental fortitude that it takes to do the job, the hours that you have to work in order to do the job. Folks, and this is not, again, not a bad thing. per se, but folks aren't willing to give up, you know, their precious time at home with their friends or family or loved ones in order to do the job anymore. And I'm not saying that's a bad thing, because I think work-life balance is very important. But the turnover rate in the industry is very high. Stress management, lack of work-life balance because of excessive overtime. So until we can deal with those crises, you know, unfortunately, I don't foresee that changing soon.
Thank you for sharing some additional context for that. I think it's an important sort of takeaway from this discussion. So the final prepared question that I had was, is there anything you would like to add that someone aspiring to go into your field, to go into your profession, should be aware of? Any, I guess, pieces of advice or things to keep in mind?
Technology is a big part of the job. It can wear on you, on your eyes, on your ears, that sort of thing. So the physical aspect of it. In my job specifically, or in the 911 center, it is very sedentary, so a lot of sitting, and that does some things too. As far as like law enforcement or firefighter, EMS, even emergency management, oftentimes it's more out in the field. So being prepared for going out into the field in whatever capacity, and being prepared for whatever you might see, hear, or have to do in those moments. As far as management, it's never too late to start a degree, and it's never too late to finish one. The educational piece, the things that you'll learn, you can apply them along the way and along the journey in any role. Like I said earlier, in this type of career, you don't have to have any formal education to start, but it is so helpful. It is very helpful. I have learned a lot. I have become a better manager from the things that I've learned. I've been better able to navigate situations that maybe I wouldn't have been able to navigate 5 years ago because of the things I've learned in the program. And so any piece of advice I would have would be study hard, do it anyway. So you only get one life. It's worth it. I work, as I mentioned, anywhere from 50 to 70, sometimes 80 hours a week. I am still doing the program. That's why online works very well for me, but find something that works for you, part-time, whatever it might be, and you can finish it. You can do it. So it takes time, it takes work, it's hard work, but doable. It'll be good.
Well, I greatly appreciate you taking the time out of your day to share your thoughts and experiences. Was there anything that I didn't ask that you feel like would be important to mention in this conversation?
No, I was just the only thing I would think of is there's some current legislation for 911 dispatchers, and if you're not familiar with it, it's coined 911 Saves Act. So give it a look, encourage your people to vote for it, so that this, you know, particularly 911 can get maybe some recognition that it deserves. So that would be the only thing.
Yeah, no, that's a good point. I mean, it's definitely to, you know, as people who either are students of public administration or researchers or people who are in the field, you know, staying knowledgeable about those kinds of bills, and to the extent possible, you know, kind of advocating for them is a good thing to do. Well, Rebecca, thanks again very much. I appreciate, you know, great conversation, great insights, and I'll be, I'm sure, talking to you again soon, because, you know, unlike some of our recent panelists, you're still in the program, you know, you're still in the thick of it. If anybody is watching this and has any questions, my name is Nathan Myers. I'm the director of the MPA program at Indiana State University. So you can find me pretty easily through the website. But if you want to reach out, if you have any questions about studying public administration or about the program, be happy to answer those. In the meantime, thanks very much and have a good rest of your day.
Thanks.